Good afternoon. Today marks our 14th of these daily briefings, 2 full weeks. So I want to start by saying how appreciative I am to the many members of the media and to the public who tune in to these press conferences every single day and help us to get the word out to the broader population of Illinoisans. This also feels like an appropriate time to offer an apology to the woman who called my office this week, angry that I've been interrupting the bold and the beautiful. I want her to know that I, too, look forward to the days when we can get back to our regularly scheduled programming. All kidding aside, getting accurate information disseminated and squashing irresponsible rumors is so critically important as we wage the battle against COVID-19. So thank you to our residents for sharing the information that I share every day with your friends and your neighbors, your family, and your social media networks. Thank you again to the reporters and the press who are continuing to do this work in such a difficult time and who are making it a priority to get good, factual information out to the public. For many reasons, this is shaping up to be the hardest moment of their lifetimes. The uncertainty, the financial pressures, the questions that people have. I want you to know that it's okay to take a step back if you're feeling a little overwhelmed. And that goes for everybody across the state. I also want you to know that even in moments when you're feeling anxiety about what's happening, hope is all around us and can still be found in every corner of this state. It can be found in the creativity and the generosity and the empathy from our people, the ingenuity of the private sector and the powerhouse research institutions that are pouring themselves into solving this problem, the calls for collaboration and community that have taken form in every county all across the state. A few days ago, Koval Distillery in Chicago, known for making whiskey and gin, announced that it would shut down that part of their operation and instead start producing hand sanitizer for healthcare workers instead. As of this morning, they had already raised over $17,000 via GoFundMe to make their product available for free. 28 Mile Vodka up in Lake County is doing the same. There are animal shelters that have seen an uptick in adoptions and fostering. Across the state, restaurants are handing out free food to kids, and people are volunteering to go grocery shopping for their elderly neighbors. And if you want a little shot of happiness, search the Twitter hashtag #ILSchoolsStepUp and read about all the schools and teachers across the state that are mobilizing to help provide meals and services to students and their families. We asked all of you to help in any way that you can, and overwhelmingly, resoundingly, you have responded. You are asking your elected officials and your local businesses and your neighbors and your social networks about what more you can do. And that's why we're here today. In addition to IDPH Director Ngozi Ezike joining us this afternoon, are Selena Roldan, CEO of the American Red Cross of Illinois, and Janae Myers, the CEO of Chicago Cares and a part of our Commission on Volunteerism, to talk more about ways that Illinoisans can continue to support each other during this period. Millions of Illinoisans rely on the kindness of each other every single day. That doesn't need to change just because you've been asked to stay home. It may just take a little creativity. Our human services delivery systems are continuing. That's why, even with a stay-at-home order, nonprofits and faith organizations are continuing to operate and fulfill their missions to help those in need. My Commission on Volunteerism, which is called Serve Illinois, is in the process of providing CDC guidance to service organizations across the state. And that includes daily health surveys and temperature checks for all volunteers and staff, the disinfecting of surfaces at each shift change, and ensuring that any group work involves fewer than 10 people at a time, all with proper social distancing parameters. In a few moments, Janae Myers will talk more about available opportunities throughout the state to volunteer and how you can get more involved. Please Do not use this as a free pass to violate the stay-at-home order. This is an opportunity for healthy college students looking for something to do, or individuals who aren't able to work from home, an opportunity for people who are healthy and looking to help. If that's you, you can register on the Serve Illinois website, and the organization will connect you with opportunities based on their needs. The website address, and please take this down if you're interested in volunteering, the website address is serve.illinois.gov, serve.illinois.gov. I also want to take a moment to encourage healthy, eligible individuals to donate blood. As this situation has evolved, the American Red Cross has seen blood drives canceled across the country. A blood shortage would only worsen the healthcare crisis that we're facing right now, so we need your help. I want you to know that there's no evidence that respiratory viruses can be transmitted through a blood donation or transfusion, and donating blood does not weaken your immune system. The Red Cross has even taken extra steps to ensure the safety of donors and staff. Selena Roldan from the Red Cross will talk more about this in just a few moments. So finally, I want to take a moment to thank the businesses and organizations that are donating personal protective equipment, what you hear about in the news as PPE, to support our response to COVID-19. We've received N95 masks, surgical masks, and other supply donations from the production and cast members of Chicago Med and Chicago PD and Chicago Fire, as well as supplies from Indian Valley Vocational Center in DeKalb County, trade unions across Illinois, and so many others. And I've heard from many businesses across our state that plan to follow suit. So, to all these organizations, know that you are truly providing life-saving equipment for our healthcare workers, and I thank you for that. If you or your business would like to help us protect our first responders by donating PPE, please contact us at ppe.donations@illinois.gov. You can email ppe.donations@illinois.gov, and my staff will reach out to you. One final thing. I refuse to spend more time on this than it deserves, so I want to quickly address Donald Trump's tweet today before you ask me. One of the things that's been most heartening here in Illinois is the degree to which Republicans from all over our state have reached out to me to ask how they can help. Even people who have had profound political disagreements with me in the past have been among the first to call or text me, asking what they could do to help Illinois in her hour of need. When it comes to volunteerism and charity and stepping up in a crisis, Illinoisans of all political stripes are doing their part. Now, I'm a pretty even-keeled guy, but even I'm finding it hard to contain my anger with Donald Trump's response to this national crisis. I have doctors and nurses and first responders begging for masks, equipment, and more tests. And I have a floor full of staff who are working day and night to hunt down the supplies that our healthcare workers and our first responders need, and the supplies we know they are going to need. We're doing that because Donald Trump promised to deliver for all the states weeks ago, and so far has done very little. So apparently, the only way to get the President of the United States to pay attention is to go on national television and make noise about it, which I won't stop doing until we get what we need. I said I would fight for this state, and I will with every breath that I have, and I meant it. I said that the other day that this is a time for serious people, not the carnival barkers that are tweeting from the cheap seats. All I can say is get to work or get out of the way. Thank you all, and before we talk about volunteering, I'd like to turn it over to our IDPH Director, Dr. Ngozi Ezike, to give you today's medical update. Doctor?
Thank you, Governor, and just thank you for your passionate leadership. He truly cares about every individual in Illinois, and we're working so hard to achieve the best possible outcome. Unfortunately, I have to report that there are 296 new cases of coronavirus disease in Illinois, including one infant. And sadly, we're also announcing 3 additional deaths. We are still learning about this new novel virus, and information and guidance is rapidly evolving. At this time, it is still unknown if a pregnant woman with COVID-19 can pass the virus to her fetus during pregnancy or delivery. According to the CDC, no infants born thus far to mothers with COVID-19 have tested positive for the virus. In these cases, which of course are still a few in number, the virus was not found in samples of amniotic fluid nor breast milk. We still need more information so that we can make decisions that are based on actual science and facts. And testing will help inform our efforts as well. As mentioned earlier this week, the state of Illinois is working to increase testing capacity by working with Illinois hospitals to implement testing within their respective facilities. We want to strengthen the testing capacity in Illinois by helping hospitals and laboratories develop their own testing ability, and we expect to have these tests up and running within the healthcare systems in the next few weeks. Unfortunately, the number of cases will continue to increase, as will the number of deaths. But we ask that you listen to our guidance and take all preventative measures to avoid becoming sick and to avoid infecting others. We are all in this together, and doing our individual and collective parts, we will see our way through this. And now I will give a summary for our Spanish-speaking audience. Hoy anunciamos 296 nuevos casos de COVID-19 aquí en Illinois, incluyendo un bebé. También estamos anunciando 3 muertes. Todavía estamos aprendiendo sobre este nuevo virus y la información cambia rápidamente. En este momento, no se sabe si una mujer embarazada con COVID-19 puede transmitir el virus a su bebé durante el embarazo. Necesitamos más información para poder tomar decisiones basadas en la ciencia. Las pruebas de COVID-19 ayudarán a informar nuestros esfuerzos. Como dijimos esta semana, el Estado de Illinois está trabajando para crecer la capacidad de pruebas en los hospitales. El número de casos continuará creciendo, al igual el número de muertes. Por favor, escucha nuestras palabras y tome todas las medidas preventivas para evitar enfermarse y infectar a otros. Vamos a salir de esto juntos. And now I will turn it over to Janae Myers, CEO of Chicago Cares.
Thank you, Dr. Ziki and Governor Pritzker, for your leadership. The goal of Serve Illinois is to build a state where all residents recognize their ability and responsibility to strengthen their communities through service. The work of Serve Illinois and Chicago Cares and so many other vital volunteer service organizations around the state are rooted in connection. We build community, we share resources, we strive to build a more vibrant and equitable Illinois. And for many of us, the COVID-19 pandemic is challenging this call to action. I'm here to tell you, though, that there's still a great need for volunteers throughout the state to help our most vulnerable neighbors. Here are a few suggestions, but please reach out to your local volunteer organization or Serve Illinois website to learn more about what's needed in your community. Most importantly, please check on your friends and neighbors. If you can, get groceries and supplies for those who are not able to leave their homes. Food banks are still looking for volunteers to pack and distribute foods to pantries and shelters. This is urgent because demand is increasing. Check out the Greater Chicago Food Depository, the Northern Illinois Food Bank, or Feeding America. Across the state, homeless service organizations like Breakthrough Urban Ministries and South Suburban PADS still need volunteers to help feed their shelter guests. In Carterville, RSVP of Southern Illinois needs volunteer meal drivers. In Peoria, the Richland Community Center needs volunteers to box food. And in Decatur, the Northeast Community Fund needs volunteers for their drive-through distribution. As you can see, packing and delivering food to those who need it is still an urgent need across the state. But if you decide to volunteer, as the governor said, please be safe and consider the whole community, particularly those most vulnerable. Practice social distancing safeguards. Wash your hands regularly. Stay home if you are sick. While you're at home, there are still many opportunities to serve your community. So go to serve.illinois.gov or follow Chicago Cares on social media to learn more. We will continue to be a resource for how you can make an impact during this crisis. These extraordinary times are helping all of us expand our definition of what it means to serve, to connect, and to support one another. Let us use this time to build empathy when we cannot always connect in person, by shifting the conversations we're having, by learning our neighbors' stories, educating ourselves on the issues we face, and asking ourselves how we can be better advocates and neighbors when this is all over. Now, let me introduce a friend, Selena Roldan, the CEO of the American Red Cross of Illinois, and I gave blood myself on Tuesday, so we definitely encourage folks to do that. Selena?
Thank you so much, Janae, and thank you, Governor Pritzker and Dr. Ezike, for your strong and compassionate leadership at this time. Our deep gratitude goes out to the medical professionals, first responders, and the many organizations providing essential services, working hard to keep us safe and responding to critical needs. Every 2 seconds, someone in the United States needs blood. The U.S. is facing a severe blood shortage due to an unprecedented number of blood drive cancellations. To date, more than 6,000 Red Cross blood drives have been canceled across the country, resulting in 200,000 fewer blood donations. Every day in the U.S., the Red Cross needs to collect 13,000 units of blood to help maintain our blood supply. Since this crisis started, over 120 blood drives have been canceled in Illinois. Blood collection is an essential function as outlined by the Center for Disease Control and the Food and Drug Administration. It is critical for the community health to maintain blood collection during this challenging time to ensure patient survival. One of the most important things that you can do to ensure that we do not have another health crisis is to give blood. Like a hospital, grocery store, pharmacy, a blood drive is essential to ensuring the health of our community, and the Red Cross will continue to hold blood drives during this challenging time to help meet patient needs. This blood shortage could impact patients needing surgery, victims of car accidents and other emergencies, those suffering from chronic conditions such as sickle cell, or patients suffering from cancer. The Red Cross is expecting cancellations to continue to increase, which is causing heightened concern for blood collection organizations and hospitals throughout the country. The Red Cross understands that people have concerns about public health at this time and want to stress that donating blood is a safe process and healthy people should not hesitate to give. It is important to note that our trained staff follows thorough safety protocols to help protect donors and recipients from any type of infection. We're asking people to please make appointments. We are currently running our blood drives with new safety and health protocols to ensure social distancing, which limits the number of walk-in donors. Blood drive locations need to be carefully vetted to make sure they meet all the FDA safety guidelines. We are working hard to add blood drive locations daily across Illinois. The severe need for blood will continue today, tomorrow, and the weeks and the months to come as we face this pandemic together. So we ask that if you are feeling healthy, please consider donating blood. You can make an appointment to donate by visiting redcrossblood.org or by calling 1-800-RED-CROSS. If you are healthy and feeling well, we also encourage you to volunteer with the Red Cross in our humanitarian mission. During this crisis, home fires will continue to occur. Major flooding and severe storms are likely this spring, and the need for a safe blood supply will remain constant. The American Red Cross is first and foremost a humanitarian organization, and this is a humanitarian crisis. Often during a crisis, We see the best in humanity when Americans step up to help one another. Thank you to every single person who has answered our call to help. Now I have a brief statement in Spanish. Donar sangre es un servicio esencial para la salud pública. La Cruz Roja seguirá realizando campañas de donación de sangre a través del estado de Illinois para asegurarse que hay sangre para los pacientes que lo necesitan. Durante esta crisis, necesitamos que personas saludables hagan una cita para donar sangre. Gracias. I'd now like to ask Governor Pritzker to please come back to the podium.
Thank you. Thanks, Selena. I'm happy to take any questions from members of the media that are here in the room, and then we'll take questions from those who weren't able to make it here today.
Hi, Governor. So President Trump responded to you on Twitter. Did you have any kind of follow-up conversation with him and his administration?
Not this afternoon. I've been quite busy this afternoon. As I mentioned, I was actually on the phone trying to obtain PPE from a variety of sources, some here in Illinois and some from around the country and the world. So haven't seen what he's responded and haven't responded back to him or had a conversation with him, though I'm always open to a conversation that will advance the interests of the people and the health and safety of the people of Illinois.
In light of the extension of the date to file federal taxes, are you going to be extending the date to file state?
People have asked this question before. I appreciate it, and I want you to know that we're working hard to figure out how we can do that. You know, there are challenges for the state of just cash flow, right? I mean, it's obviously we receive a lot of those revenues typically in April, and they're planned for spending related to those revenues that come in April. And so we're trying to figure out whether there's federal borrowing or federal help that will come down the pike that will help. I think there are a lot of states that will have this kind of cash flow issue if they extend their deadlines to July, I think is when the federal government did. But we are working on it. We think this is an important thing for us to evaluate and then do something about. Yeah. This gentleman right here. Yeah.
About the homeless, with the sheltering in, what's being done about the homeless, and when the testing do start, how will you all test the homeless?
Thank you. Well, we do have testing going in the state. It's not nearly enough, but I just want you to know that anybody that is demonstrating symptoms and that goes through, you know, a flu test and other things that a healthcare professional would put one through to determine whether they have those things before they test for COVID-19, once they've gone to that stage, anybody that demonstrates those symptoms would be tested. As for what we're doing broadly for the homeless, there are categories that we're addressing of shelter needs across the state, and we're talking about things like not just the homeless, although that is an enormous problem even in normal times. And we want to be able to address that. It's especially important now. So we are looking at ways to do that and working with the city of Chicago, for example, and other cities across the state to try to use facilities that already exist to provide temporary housing during this crisis. We also have other housing needs. You know, when you need to separate a family, perhaps someone's been exposed to someone at work, let's say, and they're in a family, maybe they have 5 people in their family, only one person has been exposed to somebody who had COVID-19. You don't want that person going home. They need to self-isolate somewhere else. And so we want to make sure we're providing housing for those people wherever we need to. So there's a lot of work being done by our emergency management agency, working with our housing experts in our government, my deputy governor who oversees those efforts. And we're working hard on all of these fronts to serve the needs, but especially of people who may not have somewhere else to go. So we want to provide shelter for them during this time of need.
We have to go to the reporters who are teleworking
Sure.
as well. Some health organizations are worried about your call to action for retired doctors and nurses, saying older retirees could be at risk. There are also concerns that PPE could dwindle faster with more healthcare workers. What is your response?
Well, let's first talk about older healthcare workers that might be retired. Remember, these would be recent retirees. Or people who have left the profession to join another profession. There are a number of people who have healthcare degrees and experience who may have chosen nevertheless to go go into some other job or career. So we're asking them to come back in. For those who are older, we certainly want people to take extra care, and we wouldn't want anybody who deems themselves to be at risk or falls into a high-risk category to come into the healthcare profession and be exposed to COVID-19. There are ways, though, for healthcare professionals, even who are older, to participate and help us and not be as exposed to COVID-19. In other words, there are a number of people who will be in hospitals or in healthcare centers that don't have COVID-19, that simply are people who are heart attack victims or have some other condition that need hospitalization. We're trying to separate those people out from people who have COVID-19 and make sure that we are serving both needs, but not spreading the virus. So there will be and are places where one can work that are lower risk than just going into a hospital emergency room or serving COVID patients. And overall, I just want to say that you don't have to be an older person to be someone who maybe left the profession or retired from the profession. You may have gone into business or decided that you want to stay home and take care of a family, and you may be now deem yourself available to do some hours as a healthcare professional. So we invite you, please, to volunteer yourselves to come back in and help us out during this time of great need.
We're hearing a number of employers are giving essential employees documents akin to an affidavit proving that they are indeed essential. Are law enforcement requiring this?
No. Let me be clear. You do not need to have papers or a permission from your employer. Nobody's being stopped on the streets unless they are, in fact, seen to be directly violating the stay-at-home order, in which case a police officer or somebody else may just ask you, please go home, or are you in fact going to your job or going somewhere that is essential, just to encourage people to do the right thing. So there's no stopping people and asking for papers that's going on.
How will you measure how effective the stay-home order is?
So that's a great question. Each one of the things that we've done, whether it's when we had to ask people to stop the parades around St. Patrick's Day, whether it was closing the schools or closing the bars and restaurants, or now the stay-at-home order, each one of those is designed to bend the curve. You've heard this a lot. So how do you measure bend the curve? Well, the first thing you have to do is test enough people. And we didn't have enough tests early on, so that's one of the reasons why you've seen these stay-at-home orders. If you couldn't determine who had it, you couldn't determine who to ask to stay home. And so you really had to just stop the spread of it by asking everybody to stay home as much as they can. But as we move forward here, one of the things that the doctors have said, the researchers have said, is that after about 8 or 10 days after the stay-at-home order is put in place, we may begin to see the increase in the number of cases reported start to diminish their acceleration, let's say, right? So instead of being exponential, maybe they'll be growing at only a geometric level. And remember, these numbers will grow even after we may have slowed this significantly. They will grow because of more testing being available. We'll be able to test more and more people and know exactly who has it. But we may begin to see, and this is up to the statisticians and the modelers, we may begin to see a bending of this curve, even after less than 2 weeks. And so that's why we wanted to put this in place for long enough to be able to see what effect we're having. And we'll watch it very closely. I mean, I want very much, as everybody else does, to begin to go back to normal as soon as possible. But let me tell you what the most important thing is that needs to happen. And it's something that's a little out of all of our control, but it is in the hands of the tremendous researchers that are here in Illinois, in Chicago, many of them, in Champaign, and also all across the United States and the world. And that's they're researching treatments and therapies, and they're getting closer. There are 2 or 3 that have been in trials even now, one of which seems more effective than others, but we won't really know until we get the full results of those tests. But the truth is that we're going to rely upon them to help us with treatments, Once we get treatments, I think all of us will feel a little bit of relief that we know that we can save lives. We know that we may be able to, bend this curve even more. And then, of course, finally getting a vaccine to protect people entirely from it will be the most important thing we can do.
How much money are we taking out of the state's rainy day fund to help medical facilities and testing centers?
So I think many of you know that the state for many years didn't have much of a rainy day fund, and I want to say that we've worked hard so far. I've been in office now 15 months, and we've worked hard to look at ways that we could build up that rainy day fund. Well, now, as you can imagine in this crisis, there's no way to build up that fund. It's a very, very small fund in the state of Illinois. Having said that, all the states in the United States need help from the federal government. That's why you've seen in some of these stimulus packages, for example, support for unemployment benefits, unemployment insurance, as one example. But we're all going to need help with our state budgets because revenues are declining in every state as we have had to, slow things down to keep people at home. But also we've seen an increase in expenditures because we have social services that we want to make sure we're providing for people who may be suffering economically, financially from this virus. So we have a lot of needs, I would say, that we can't meet with a rainy day fund in our state. And so we're going to do everything that we can to meet those needs no matter what.
And this will have to be our last question. Is there somewhere people can call to denounce if their place of employment is open and they don't think it should be?
I would encourage people to call the Department of Commerce and Economic Opportunity. We have a hotline where people can find out if their business does in fact meet the requirements of an essential business operation in the executive order. And I don't happen to have that number in front of me right now, but I will make it available. I'll certainly announce it tomorrow since I didn't have it with me today. But you could just look up the number of the Department of Commerce and Economic Opportunity, call the general number. They will direct you to the hotline, or you can go to our website. And I do want everybody to have this website, coronavirus.illinois.gov. That will have the updates from all of the press conferences that we've had, all the announcements that we've made, the phone numbers that you need to call if you need unemployment, you need health care, or if you want to find out an answer to a question like whether your industry is covered by the essential business operations exception.
Thank you, everyone.
Thank you very much, everybody.